Thank you, everybody, for dialing in. We're just going to hang on a moment as the numbers just climb up. We have quite a few participants. Just want to give everybody a moment to dial in, and we'll get started shortly. Thank you. All right, looking at the clock, I think maybe we'll go ahead and dive in and get started. So thank you, everyone, for joining us for our third in a row of sessions that we've had. This is our information session on our new PMDE program. More specifically, we'll be focusing in on our standing offer contracts and the RFP that is currently up for that process. So my name is Tarry. I'll introduce myself. My name is Tarry Ahuja. I am the director of the PMDE program, and I'm joined here today by Nadine Zolticki, who is our program lead of the PMDE program. We will start by going through a bit of the program itself, and this might be a refresher for many as we presented this previously, but we should do the same so that everybody who's interested in the RFP for contracts is aware of what the program looks like and where the standing offer contractor section fits in. So why don't we get started? So Nadine, maybe next slide, please. So we'll talk a little bit about the transition of our program from DSAN, which we're currently sits, and we'll talk a little about the program itself, and then we will walk through the process for the RFP for standing offer contracts, and then we'll talk about our next steps and remind you of some of the timelines that are coming up. And we'll I'm sure, have some time for some questions at the end, and so feel free to get those ready, and we can share those questions through the Q&A. As a reminder, today's session will also be recorded and will be posted on our site afterwards, so you can take a look at some of the answers if you didn't get them through us, and you can send your questions, and those will be posted as well on our RFP site as a bulletin. So for those of you who did not know, in the fall of last year, it was announced that DSAN and its function would be transitioning from CADTH to CADTH. So we've been working in that time to establish processes and infrastructure to start this transition. And we have put together a transition team with myself and Nadine and a few others to allow that transition to happen. And in that time, we're working very closely with Health Canada and CADTH to ensure all the great components of the existing network are maintained. And we look to innovate and modify the network to meet the needs of decision makers today. Our goal is, and this is sort of a non-negotiable goal, we're making this happen, and that's by September 22, we'll be launching our new PMDE network that will be now residing with CADTH. So let's talk a little bit about the program, and I'm going to point you to our PMDE website, our landing page within the CADTH site, which has a document called the program, PMDE program overview, which has all this information. But I just wanted to highlight some of the goals of the program. So the first, and I'm going to almost read this verbatim because it is quite important, and it's to enhance the pan-Canadian post-marketing query response capability by creating an efficient and responsive network of applied researchers, that's really important, methodologists, and data analysts to meet the needs of decision makers. So a couple of key things here is I want to highlight that this is a multifaceted team with a variety of people within the network, and that we're really doing this to meet the needs of the decision makers. So the federal and provincial decision makers. We want to leverage the post-market information that is available in our country and to improve the linkages between the researchers and data analysts, stakeholders, and decision makers that are doing this actual work. We want to, once we have these products in hand and have these queries in hand with some answers and some data, we want to really increase the amount of uptake and utilization of this data. So a lot of times great work has been done both inside and outside of this network, and it's only utilized by those who request it, even though several outside of the network, outside of those initial decision makers, would really value from this information. And we want to create a culture of continuous quality improvement and keep meeting the needs and innovating as years go on. And last, we want to foster national and international PMD partnerships to identify and streamline processes. So this group is not the only game in town, really. There's other countries and other organizations that do similar work, both within our country and outside of our country. FDA Sentinel is one, NCEP is another in Europe, and these are great groups that we can connect with, and we have already started that process of working with them to see how we can leverage their information and learn from their processes and vice versa. So let's take a look at what we've crafted now. So this is a snapshot. It seems overly complicated with a lot of colors and bubbles. We'll walk you through the basics. It's pretty straightforward once you see it. And this is how we structured our PMD program. So top, we're going to have, as you can see here, we're going to have our requesters. So these are the decision makers that we're speaking of, and these are the ones that can put forth a query. So you have Health Canada, the Federal Drug Programs, Public Health Agency of Canada, the provincial and territorial decision makers, ENES, which is our CADTH Quebec counterpart, PCPA and PMPRB. These are an example of those that can put forth a query saying we need some evidence. And then we would tap into our network. So the query will come in, as you can see, and this would go into what we've named a PMD Operations Center, or POC. And this is a centralized body that would sit within CADTH that would help triage and work out these queries. It will help with scoping and refinement, looking at applicability, the appropriate product, agreement on timelines, all the work that needs to be done before you actually hit go. They'll also do a feasibility assessment. We'll take a look at, has this question already been answered? Is there data that's already available? Is there a publication that's answering this very question? Let's get some of that work done before we proceed on to the next steps. Now you see a dashed line to the right, and this would be our advisory panel, which we've now more recently updated to advisory committee. And this advisory committee is going to provide us some guidance on approaches, the most innovative and current approaches on how to deal with complex queries. We can do a lessons learned and post hoc analysis of some of our PMD work to ensure that did we actually tackle that correctly, and create that collaborative environment and learning environment. Now, once a query is sort of approved and has got the legs to move forward, we then engage and initiate with our network. And that'll be our next slide, please. So here we can see that the next step is that the query will then go to a combination of one or three of the following pools of resources. And so on the left, we have our core network partner. And this is an RFP that is already up currently. And these are for individuals that will represent, we'll say, the foundational teams of our network. And I'll get into that in more detail in just a moment. If we can hit the next slide, Nadine, please. And so we'll go to the next slide and we can see, excuse me, that this group, if you can just hit bar, Nadine, please. So this is going to be multidisciplinary teams. And depending on the team, they'll have a variety of skill sets and resources within the team. So they might be just a couple of people, it might be a very large team that do, have niche work on a specific area, or might be really faceted in a variety of areas like health economics or mixed treatments comparison, looking at data and data trends, systematic review. There's a variety of things that they can do. They'll be awarded 3-year grants, honored on a 1-year basis and reassessed, and this can go on up to 3 years. And we're looking for about 3 to 4 teams. And I said, these will be the foundational pieces that'll make the core of our network. Now, the next piece of the puzzle are standing offer contractors. And that's why we're gathered here today. And that's to talk about that RFP. Now, what is an SO contractor? So an SO contractor will have a lot of similarities to the core network partner in that they're multifaceted teams, but they'll have a specific methodological related expertise in an area. They might be an individual or they might be a group of individuals, and they'll be awarded 1-year contracts with the option for 2 1-year renewals. The contractors will be on retainer, and so they'll be given some funds and they will then be on standby to answer queries for the network as they come in. In the negotiations, so in the discussions with those who apply, we can talk about what is the capacity of the team and therefore what is the number of queries it can handle per year. That is how this arrangement will work. And the way it will work is that if a query comes in and a component of that is sort of specific or niche in terms of required skill set, and those skill sets are contained within one of the teams or individuals on our standing offer contractor, that portion of the query might go to them while another piece might go to the core network partners. This will do two things. This will allow us to address a wider array of queries that are coming in from the decision makers. It'll allow for more efficiencies and better timelines because we now have more individuals working on a query. And it'll also improve the level of collaboration that we're seeing within the network. So we have a variety of people that are working with one another and other teams and working outside of their bubble, which we feel is really important. Next slide, please. There was a third column on our initial figure that was another set of bubbles at the bottom, which is our ad hoc contractors. We're not going to spend a lot of time on that today, but these are individuals that if the core network partners and the standing offer contractors cannot address or our demands are so high that they're all really busy, we'll have a third pool of individuals that we can tap into, and those will be the ad hoc contractors. Again, these will be individuals that have a required skill set and would be asked on as an as-needed basis, thus the name ad hoc. And we will not be going through an RFP process because it won't be necessary, but we'll be highlighting and identifying those from individuals that are coming through our network that CADTH has experience working with, or you on the line, if you're interested or you know of individuals that may be of value, we have no problems taking names and speaking with folks to see where they could be useful and how they can contribute in the future. So why join us and why are you here today? Well, there's a lot of positives we feel with being part of this great network and this team, but we'll highlight a few here. So one, it's to make a difference, and that's to conduct important, impactful, innovative research to really help those decision makers that are making some really big decisions. And I think the last few years with COVID and this global pandemic have highlighted that we're really making some challenging decisions, and that they're best made with evidence in hand. So you can be part of that and in producing evidence. We really want to create collaboration and create this really great spot where smart, dynamic folks are working together to answer queries. And this collaborative research community will allow for that. You would have the opportunity to work with folks that you might not normally work with, or see evidence and approaches that you might not normally see. And then last, which is something that aligns very closely with CADTH's objectives, and that's to protect the health of Canadians while shaping the future of Canada's healthcare landscape. So these are really key pillars for us and things that are really important into why you might be interested, might want to consider, or be fortunate to have folks work with us on this network. Okay, so I guess we'll move forward on a question that we've been asked a lot is, well, how much funds are available and where are those funds going? And we'll move on to that section of it, which is the funding model. And for this, I'll pass over the mic to Nadine, and Nadine, maybe you can walk us through the rest of this.
Great. Yeah. Thanks, Terry. So, we've gone with a hybrid funding model for our program for the PMDE network. So, as you can see, we have 65% of total funds going to the core network partners. So these are the grantees, and then 35% going to contractors. And this is further broken down. So 70% of contract funds going to the standing offer contracts. And then we are reserving about 30% of that for the ad hoc contractors. So this funding model allows a few things. So it allows us to be nimble, but also stable. So by having the core network partners who are granted and available and ready to take on queries rather quickly, this gives us stability. And then the contractors allow us to be a little bit more nimble and to bring in additional expertise. And also, if the volume ever became too much for the capacity of the network, we would be able to add in those ad hoc contractors as needed. So I'm going to move on to the RFP. So last Tuesday, we released the RFP for standing offer contracts. So that was March 15th. Today, March 22nd, we're doing this information session, and we'll also be releasing the 2 forms and guidance documents for the full proposal to this RFP competition. The forms for the form and the guidance document for the letter of intent are already up on the website, and the deadline to submit a letter of intent will be April 8th. We'll be accepting questions and inquiries about the RFP until April 22nd, and we have until the 26th of April to post the final bulletin with responses to those questions. And so please keep an eye on the website. All the bulletins are being posted there. And then finally, May 17th will be the deadline to submit your full proposal for this competition. So the letter of intent is a pretty simple document. It's just to let us know that you intend to submit a proposal. And what we're asking for at this stage is just your name and the names of the co-applicants, if it's applicable, the host institution, again, if that's applicable, and then a brief description of the expertise of you and your team. And then for the full proposal, we've broken this down into two parts. So there's a technical proposal and a financial proposal. So the technical proposal holds the most weight with 75% of the overall evaluation. This will be a Word template form, and it should be submitted as a PDF document. There are formatting requirements that'll be all explained in the guide document. And the maximum is 12 pages. And then for the financial proposal, this is 25% of the overall evaluation. This is slightly different from how we did with the grants. It's a lot less detailed budget. So we're asking for hourly rates for everybody on the team, as well as administrative overhead. And this should be submitted as a PDF document. So there are a few elements that you'll be evaluated on for the technical proposal. So you'll see the 4 elements here. So that's suitability of the applicant, historical work, feasibility, and then additional. And there's more information in the RFP document in Appendix A about this, but I'll just quickly kind of go through each one of these. So for suitability of the applicant, we're really looking to make sure that the expertise and the methodological expertise that the team brings lines up with the PMDE program and the network and the goals that Tarry went through just a few minutes ago. We're looking for a willingness to collaborate. We're also looking to see your understanding of the regulatory and or HTA process and how those decisions are made. And for the historical work here, we're really looking for concrete examples of work that you've done in the past 5 years. And we'll be looking at the methods and the caliber of work. We're really looking for international caliber. And then the feasibility. So here we're asking applicants to provide a range of queries they might be able to take on in a given year. And that your hourly rates and such are within the total bucket of money that we have for contracts. So is this a reasonable amount for the total amount that's available? And then for the additional here, we're just asking for 2 to 3 references and a letter of support from the host institution. So again, there's a lot of detail included in the RFP and as well as the proposal forms and guide. So the financial proposal here, so we're looking, you'll be graded or evaluated on financial feasibility. So I've already touched on that a little bit. So the hourly rate are within reason, and that you have access to appropriate facilities and resources already. And again, so the additional documents, we are looking for 2 to 3 letters of reference. And if you are affiliated with a host institution, this letter of support that would also indicate their willingness to negotiate with CADTH in a timely manner, keeping in mind that we are launching in September of 2022. So next steps for the RFP. So again, here I have a timeline. So April 8th is just around the corner. So that's the deadline for the LOI. May 17th will be the deadline to submit your full proposal. And then on June 7th, we'll be giving notice to all applicants if they were successful or not. And then of course, September 1st, that standing offer period begins and goes until August 31st of 2023. So going back to funding, so we mentioned there would be a retainer. So unlike grants, which are submitting a full budget and we decided to give a certain percentage up front, it's a bit harder for these standing offer contracts because we don't know exactly how much work we'll be issuing. So instead, we'll be issuing a retainer, and that'll be decided based on the team and the skill set and the expertise that they bring. And then the remaining funding will be released when queries come through and we issue call-ups with the contractors. And then the last thing is we will be asking successful contractors to submit quarterly financial and performance measurement reports. So there will be a template for this. And then an annual media report will be required at the end of the contract period. So I'll finish off just by pointing you to some of the resources that are available. So we do have that PMDE program overview document, which is a pretty big document, and it's available on our webpage. And then we also have some frequently asked questions here about the program. There is a separate web page for the RFPs, and that's also where we're posting the forms, the guide documents. All the questions and answers are available in bulletin documents, so keep an eye on those. And then finally, a reminder that if you have questions about the RFP, they have to be directed to our contracts. Tarry and I cannot answer questions directly from applicants, so please make sure you send those to contracts. So, and of course, reminder that we'll be posting this session on our webpage as well. So I think we'll stop there and we'll start taking questions.
Thanks, Nadine. So feel free to use the chat box on the side. The questions will be coming in and we can start going through those. I have a couple that have come in. Some of these are, I think, straightforward, so we should just tackle those. We've mentioned them already a little bit in the presentation, but it's always good to repeat some of these basics. So I'll pose the questions to you, Nadine. So the first question is, who's eligible to apply for a standing offer contract?
Yeah, so for standing offer contracts, we are accepting proposals from individuals and teams of individuals. However, just wanted to flag that we won't be awarding to for-profits, consulting firms, or industry.
Okay, thank you, Nadine. I think that answers that question. A couple questions have come in on points you just made. So one, it's a part A and a part B. First one is, where again do we submit our questions to, and how long until we can continue to submit questions to you?
Yeah, so questions all have to go to the contracts at CADTH email address that I just showed on the screen, and we can show it again or pop it into the chat. And you will have until April 22nd to submit all questions, and we'll respond to all the questions in bulletins by the 26th of April.
That's great. Okay. Next up, will contractors be given funds up front similar to grant holders?
Yeah, so as I was mentioning, we will be issuing a retainer right at the beginning, so September 1st, assuming that the negotiations with the host institution are finalized, and that'll be determined based on the team, unlike the grants. So the grants, it's a bit different because they have a budget and we're giving them a percentage up front of that budget, but for this, it'll be a retainer that'll be negotiated up front.
Okay. And a related question, is there a maximum amount for the retainer or a range of acceptable values?
For the retainer,
Yeah.
so that'll be determined based on, there will be a discussion, I guess, with the CADTH PMDE team and the successful applicants. So we're not asking applicants to tell us what the retainer is. We're only asking for hourly rates and the administrative overhead in your financial proposal. Okay,
that's great. Thank you, Nadine. Another one coming in again, what is the deadline to submit questions about the RFP? I think we've already answered that. So it's April 22nd. We also, and I just want to highlight this point because this was something that a lot of individuals for our current RFP for grants process were unaware of, is when questions come in, we do have an FAQs spot on our PMD landing page, but questions directly related to the RFP process are embedded in a bulletin. So for a lot of folks that are unfamiliar with that is, it's a fancy way of saying there's a document that comes out as a slew of questions come in, and our PMD team has been crafting answers and they're put into a bulletin, and the bulletins are found on the RFP site, which I know is a little bit confusing, but you can find lots of answers on the RFP page if you go into the appropriate RFP. So there's now RFP for grants and RFP for standing offer contracts. And within either of those pages, you'll see some bulletins down below. You can click on the bulletin, it states the question and it states the answer from CADTH. So you can review some of those. If you ask us a question and we've already answered, we will direct you to that appropriate bulletin. We're happy to answer program-related questions. Those can come through to the team, but RFP-specific questions will need to go to contracts@cadth.ca. I still have a couple questions that have trickled in. Again, feel free to answer questions. This is your time to ask us anything related to this process. So we would like to use this efficiently. Nadine, can applicants modify their proposal forms?
Yeah, so we did receive that question already. So the forms are intentionally in Word so that they can be modified because the form is set up so that each section is in a box. I recognize that it's not using up the full margins and that sort of thing. So if you decide to make your own form, just make sure that you're answering all of the questions and filling out all of the sections. But there are guidelines about the font, the margins, and the page size, and that'll all be in the guidance document that we're releasing today.
That's great. Thank you, Nadine. So I don't see any more questions coming in. We'll hang around obviously for a few more minutes and see if you guys have anything else. While we're waiting, I guess I can mention a few things. So Nadine, I don't know if you can maybe go back to the slide presentation and you can put up the additional resources. So the second last slide. I just wanted to highlight because it can get confusing navigating all the different landing pages and sites. I just want to make sure that it's crystal clear for everyone here of where you can get information. So we have something that we're calling the PPO, or the program overview document. And this is a great 20-page read that has all the specifics of our program and might answer a lot of your questions. We also have a lot of FAQs on that same page. So this would be our PMDE program landing page on the CADTH site. Then on a separate page, on a separate site within the, separate page on the CADTH site is the RFP page. And on the RFP page, we have two separate RFPs. One is up for grants, and one is now recently up for this standing offer contractors, which is why you are here today. So you can click on either of those, and it will give you more information, such as bulletins and other related documents that Nadine has outlined. There you will find your application documents, and guidance documents will tell you how to fill things out. And if you had, like we said, questions, you can go to contracts@cadth.ca. Okay, so we have an interesting question that's come in. So somebody's saying that they're struggling a bit to know what the actual work would look like, i.e. will the grant winners need to access, collect data or such, or will that be provided? So maybe I'll tackle that one. So the idea is that a query will come in from one of the decision makers, and the operations center, the PMD operations center, will take a look and see where the data lies, what needs to be done and how the query can be dissected. It might just be a straight query that goes to one team to do all the work. It might be broken up into a variety of different teams that are doing different components. No team will be mandated to go get data. It's more like, does that team have access to certain data, or the PMD group will do its best, and the network itself will do its best to try and assimilate data or use publicly available data, either publicly available manuscripts and articles, or from data sources that we're currently in negotiation with to try and have access to, or one of the teams on the network may house or hold the data. So the standing offer contractors may be asked to perhaps write certain sections, to do certain analyses, and that data will be provided if that's their request. It might be to write sections of a report. It might be to write the report. It might be to do HE analyses. It all really depends on what the skill set of that team is and what the needs of the query are. So I hope that clarifies that question. Great, thanks, Adam. We'll hang around for another minute or two, but if there's no other questions, we don't want to waste your time. You, like I said, have a variety of resources where you can continue to get information. This isn't a one and done. We are here for you to assist you in any way that we can. We have all the guidance documents. We have an email. We have the PPO, which is available on our site. And take a look for those bulletins, because you will see questions coming in and answers being posted. So seeing how there's nothing further, I thank you all very much for your time. I thank you for your interest in our program, and I hope you plan to apply as standing offer contractors, and we look forward to working with you. Thank you so much, and have a great rest of the day, everyone.
Thanks, everyone.